I'm Lottie. I'm a Consultant Community Pediatrician working at Brighton General, and I've been using video recording for the last couple of months now. I've been using video calls to be speaking with my patients who are children and their families. And I've also been using video calls to be having meetings with colleagues when we can't be having face-to-face meetings as well. So I've been having a lot of experience with the technology and found it to be very, very useful in the current situation. I've found that the video technologies I've been using have been very quick and easy to use. They've allowed good connection. You can hear each other talking very well, and you can see each other very clearly on the screen. It's been really nice at this time when we can't see people face to face, that you can actually see people on the screen. So you still feel like you're having that communication with people. It's nice to have that face-to-face contact, especially for our families when they tell us very personal things. I think it's very nice for families to feel that they are talking to a face rather than just someone on the telephone. That's nice for us also as doctors and other healthcare professionals to be able to read body contact and body language as well when we're talking to our families, and it allows us to not only hear the stories of our children and families, but also pick up on the non-verbal cues that you get from body language when you're talking to someone. And so that's been a real bonus about using video technology at the moment. Another positive to this is that in the appointments we've been able to have multiple healthcare professionals joining an appointment with a family, and so that means as a doctor I've been able to have a physiotherapist or a nursing colleague sit in with my family, and so it means that the family can have input from many different services in one go through the use of video technology, and that has been a real benefit to families. Speaking to families, they have given us lots of really good feedback about their experiences as well of using their technology. A lot of them have found it very easy to log on and to use the technology. They've been using it through their smartphones or through their desktop computers, and they've really liked the fact that we could see each other when talking to each other. They've liked that we have been able to watch their children play in the home environment, and we've been able to do some sort of examinations, for example, if we've wanted to watch a child walk or do some other skill. That we've also had comments from families that through this technology, even though they were having maybe some more trickier conversations, they felt that as healthcare professionals, we were still able to listen with compassion and respect during this difficult time, which was really lovely to know that we were still able to offer that closeness, even though we're in a very distant time. A lot of families have also spoken about the convenience of having a video consultation. They've spoken saying that they don't have to take time off work and the child doesn't have to come out of school. They don't have to spend time getting multiple types of public transport or find parking to get across the city to come to the appointment. And actually that is of a real benefit when having these appointments, especially if their child has a lot of different appointments with different healthcare professionals. Listening to all of these comments as a team, we've therefore thought that actually, is this a method of having appointments that we're going to use in the future? And we definitely think that there is a place for this in the future to complement the care that we are providing at the moment. And so we are working with families and with all of our staff to work out the best use of this technology, because I think we've learned a lot of how we can provide the best service and the best care to our families and our children.